Hello, welcome to another edition of the Freedom to Formulate podcast. I'm your host, Michael Loomis, and today I'm here with someone I've worked with for over 5 years now, and one of my favorite people I've gotten to work with, and I think, she's just a great human, really cares, but just also her just desire to keep learning and growing and just really sewing into other people. Like she genuinely really cares about this. And so, I'm excited to have her on. Her name is Dr. Emily Gutierrez. So she got her doctorate as a nurse practitioner at Johns Hopkins University, and she's nationally recognized as an expert in functional medicine and specifically, neurodevelopmental disorders in mental health. So Emily, I could keep introducing you, but it's great to have you on.
Thanks for having me. We have had some fun formulating nutrients over the last 5 years, and then I was engaging with personalized nutrients even before that. I've been using you guys for quite some time.
Yeah, no, you really have, and it's been fun. It's been fun to see how you've developed and grown in your space too with what you're doing. And we can have you talk about your brand a little bit later on, just kind of near the end. But yeah, just kind of curious. Obviously, I know been in this space for a while. Was this as you started as a nurse practitioner and got into kind of the medical world, like, was this the route that you always wanted to go, especially with the neurodevelopmental and mental health and functional health, or how did you really get into that space?
That's a good question. And I think all the providers in this space have their own personal story. And it probably wasn't one thing, it was probably a accumulation of things. But personally, where my life really changed is when I started to understand my own methylation pathways. So I have two kiddos, one's almost 23 and one's almost 19. And I adopted my second one, and I'm so glad I did. I love her tremendously.
Wow.
Uh, but I did because after my first, I had really severe postpartum depression. In fact, there were times where it was more postpartum psychosis.
Mm,
And I didn't really know a lot about functional medicine. It was back in the day where you're counting calories and,
mhm.
how
Yep.
many like 90-calorie Oreo packets could you eat in a
Yeah.
day and still
Yeah.
stay under. I mean, my health was a wreck. And, at that time, some medicine helped me get out of that space, but I really started to exercise, pay attention to my nutrition. And then I read every single book that I could get my hands on about methylation and B vitamins. And that's when Amy Asko was publishing a lot of stuff and Ben Lynch was hot in the space. Not that he isn't now, but I just read everything. And when I applied those principles to my own mental health, I mean, I crawled out of a very deep,
Wow.
dark hole.
Wow.
And it just set the stage for, okay, so what else is there that we're not being taught? And how
Mm.
can I apply this to other people? Because these changes are so incredibly meaningful and it certainly transformed my own life.
That's cool. Yeah, I guess I hadn't heard that story in totality. I mean, one, it's awesome you adopted. That's such a good work, and I'm sure that's been so fruitful for you. But yeah, I guess when it came to, well, like, what did you really figure out in that process? Just real quick about your own story that kind of got you out of that hole, because I do think the prenatal, the post having a baby space, there's a lot of noise, right? And a lot of people do still like struggle with that postpartum depression. So just real quick, I know this isn't, you know, fully your specialty of what you're doing, but yeah, what is there any tools for people, or what really helped you kind of get out of that?
Yeah, well, it's interesting because some multivitamins now have the correct nutrients in them to support
Mm,
pregnancy and postpartum, and others still have just awful, cheap nutrients. So the people that are making them make the biggest margin.
yeah.
I mean, how I fell out of it is or how I really started to really change my health is, started checking things like, well, where was my B vitamins? Where was my B12? Where was my homocysteine? And I started to really support my methylation through therapeutic doses of B vitamins. And that was better than the Lexapro I was on.
Wow.
In fact, it helped me to eventually wean off of that. And I've been medication free ever since. But I
That's
can tell you, Michael, if I don't take my personalized nutrient because I compound my own nutrient,
awesome.
because I don't want 8 bottles of things. I've been doing that for myself, my family members, and a lot of my patients for many, many years. If I don't take it, it's noticeable.
Oh,
And it's like, methylfolate is my Prozac. It
yeah.
is. It just
Interesting.
is. So
Yeah.
understanding that and how there's so much genetic variation in that, it reduced shame for me. Like, why couldn't I just get my
Mm,
act together and bond with my infant? And why was, I basically having a panic attack when I went to bed and I woke up? I mean, it was a tough time. So
yeah.
understanding and supporting methylation through that is very important. And then, of course, like if you don't methylate well, you're more likely to have estrogen toxicity. I didn't do anything to support the decline in my hormones after birth. I had gained more weight than was recommended during my pregnancy. So I had all that toxicity and those hormones and the shift from like having a robust amount of hormones to basically none,
Wow.
very poor methylation. And at that time, I was overfed and undernourished. You
Mm,
know, I didn't have the supply to really get me back to homeostasis after having a baby.
yeah. Wow,
So,
yeah, it's funny you mentioned the calorie counting. I was a basketball player, so I did the whole calorie counting thing, and I was eating the Skinny Cow ice cream bars, and I'm
oh
thinking,
yeah.
I'm doing a great job. You got the number, but yeah, it could be so detrimental to people. And yeah, thanks for sharing that because I think that you mentioned the word shame. I think a lot of women go through that, post having a baby where they're having that postpartum depression and why am I feeling this way and I can't show up for my kid. And it is kind of a shame-filled experience. So even just hearing your story on just some small tweaks that you made and diving in can really change things, I think is awesome. So
It
um
is, and if people knew about it up front, like when we get patients ready for pregnancy, like, there's so much that I wanna prepare a mom for in
mm,
order to go into that experience. It's like, the old adage, "An ounce of prevention is worth a pound to cure," and
mm,
there's so much you can do to get your body ready, to decrease your oxidative stress, lower your toxic burden, and then, strategies for how you're gonna go from having, these very high levels of hormones to basically lower levels, and what does that look like? In just knowing it's more physiological and not this, I mean, I'm a pediatric provider. I love kids.
yeah, yeah.
Well, but in that time in my life, it was hard for me to bond with my baby. And
Wow.
I was afraid to be around him when I was alone.
Yeah.
It was tough. It was tough, but there's so much that you can do to prepare a body and then to support. And it's like that just opened up a whole world for me. Like, what else are we not being
Yeah.
told? What else
Yeah.
is there? And it's really in this space of mental wellness, neurodevelopment. This is the space that functional medicine shines the most to me. And if I had to pick one system that like if we just had this one system, we could deal with all the other system dysfunction. It's like when you don't have your mind and your mental health, I
Mhm.
mean everything else is pretty rough. You can be an amputee and not have a limb, but if you have your mental health is sound and you're like, I'm going to make this work anyway, then you can tolerate what your body can't give you back. Does
Yeah.
that make sense?
Yeah, I mean, my I went through some stuff in college, and one of my biggest fears for a while was the idea of schizophrenia, like, the ability of not being able to control your mind, and that's wasn't what I was going through, but that's just such a scary thing because you can get through everything if you have your mind and you're able to have perspective and things like that, but the mind part's hard, and yeah, it's like you just never know, like, I think I had some mold exposure and I overproduced glutamate, so I had some OCD type
Mm.
stuff, and so that
Oh, yeah.
all plays into it, but, I coulda easily just taken a pill and been a lifelong, you know, taker of that, and who knows how it woulda worked, so I think, yeah, just what we're able to do to really help in the functional medicine space, all the experts are it's so awesome to see, and, but yeah, I'm kinda curious, I know obviously you're an expert in a lot of things, there's a lot of talk right now around folinic acid, right? Coming out of how it helps cure autism and things like that, and I know that's something you're pretty passionate about, and you've spoken on it here recently, and so I know it's a wide-ranging topic, but if you wanna speak to, because I know it also helps more than just autism, right? You're looking at mental health, seizures, a lot of different things. So, yeah, how is the use of folinic acid kinda changed things for you and how you're really helping your patients?
Well, if I had to pick one nutrient that I loved the most to talk about, it would be this form of folate. And, I started to learn about folinic acid being a fellow of the Medical Academy of Pediatric Special Needs. In 2004, there was some original research published in the New England Journal of Medicine delineating that folinic acid could be a way to rescue something called cerebral folate deficiency in children with autism.
Mm,
So, when our leadership in our government got up and said, leucovorin cures autism, or we found the cure for autism, it wasn't quite said that way, but I was overjoyed and also so disheartened at the same time, because you have to understand the science to understand what they're even saying. And first of all, leucovorin is high dose folinic acid.
mhm.
Folinic acid is one step before methylated folate. In fact, I begged you guys to put folinic acid in your formulary. I don't know, it was 4 years ago. And I use it every time I formulate a compound. I put a little splash of folinic acid in there, and sometimes I
Yeah,
put a lot of a splash of folinic acid, depends on
yeah.
what I'm treating. Um, but this form of folate, basically, if your brain, if your brain has antibodies or blockades on how it's getting folate through the blood-brain barrier via the cord plexus, you can have a serum level or in the blood that it looks like your folate's really high and okay.
Mm,
But really, if you tap someone's cerebral spinal fluid and look at their spinal fluid, they are replete. They have no folate in their serum. And so it's not bathing the brain. So the folate isn't available in the brain, even though it might be available in the body.
mm.
And so there's genetic pathways that are around that. And then there's also just a lot of autoimmunity and oxidative stress. Have you heard of Hashimoto's thyroiditis before?
Yeah, I can't say I'm an expert in knowing about it, but I do know of it. Yeah.
Yeah, a lot of people know about it because they know it's the best example of sometimes we make things like thyroid hormone, but that we can't get them to where we need to get them, like inside the cell, because there's antibodies or these immune molecules that are basically blocking the process, right?
Mm,
And when you have a lot of inflammation in your body, this can be one of the pathways where you're blocking the nutrient absorption into the brain. So you have these antibodies, and it goes through, without getting too technical, it goes through the folate receptor alpha. It's the main form, and it needs energy, ATP, to take that folate through and transport it into the brain. So if you have a lot of mitochondrial stress, if you have a lot of oxidation, if you have a lot of antibodies, this process can be really poorly done. So there is another carrier called the reduced folate carrier that will also get folate through. And that happens through a process called facilitated diffusion. So basically, we need to increase the serum levels so greatly in the blood that it goes through active transport into the brain. So you're balancing out, where the nutrient is at, if it takes you back to biochemistry. So the reduced folate carrier has an affinity for folinic acid, and it will uptake it when there's binding or blocking antibodies preventing you know, or poor mitochondrial energy getting folate through the other way. So it's like this it's this beautiful back door. It's
yeah,
basically what it is.
yeah.
And it can be really, really, really impactful for neurodevelopment. I mean, we know when you get pregnant, what do they tell you the number one thing you should be taking?
Folate.
Folate.
Yeah.
Unfortunately, still some people say folic acid,
Yeah.
and that is a toxic form of synthesized man-made folate that has, 5 or 7 genetic pathways that it has to flow through to get you into these active forms. So we're seeing supplement companies change it to the most active form of methylfolate, 5-methylene tetrahydrofolate, which is awesome. But when I get people ready for pregnancy, I also give them a little bit of folinic acid,
Yeah.
because why not? It's not going to hurt anything. And what if it
Yes.
really, really helps in ways we know? Because some of this folate transport, guess what? It also happens in the placenta.
Mm,
So it's very important for development.
yeah. So a couple things I want to ask about. So when you said, you use different forms or dosing of folinic acid based upon what you're dealing with, like how are you determining the right dose
Mm,
to give?
great question. Well, so if I really think a child with a neurodevelopmental disorder, either autism or, you could even suspect it in somebody that has treatment resistant depression or epilepsy. There can be cerebral folate deficiency in epilepsy, certainly. So I will dose anyone from just 2.5 milligrams per dose upwards of, I have my highest patient now is on 75 milligrams twice a
Wow.
day.
Okay.
So it
Yeah.
depends on what I'm treating. The standard for neurodevelopment is 2 milligrams per kilogram, maxing out at 25 milligrams twice a day. So like that 50 milligrams. And I think in personalized nutrients, that's where we max out, is you can give 50 milligrams a day in the formula. And
Uh,
that was very intentional. You had it lower and I was like, hello, can we raise that some, please?
yeah.
Um, and you raised the threshold for us.
Yeah.
So but in some of my kids, I met with a family last week and mom was like, okay, I know he's on 75 twice a day, but every time we raise, we get benefits from, we get speech benefits. So can we keep going? And I just was like, I'm just going to stay there.
Yeah. Yeah.
We're going to
Yeah.
stop. It's the highest I've prescribed, but
Yeah.
some of the researchers that have done this work, Dr. Rosignol told me a couple of weeks ago, he's one of the key researchers in this area, that he has people on, 100 milligrams twice a day, and they're coming in for folinic acid IVs as well.
Oh wow.
So, I don't know any contraindication to it, except for one very, very, very rare variant that is less than in 0.0001% of the population. And that's basically the gene that helps you to convert folinic acid into the methylated form. So when it gets into your brain, you still convert it to methylfolate. Some is left as folinic acid and it goes and repairs RNA and DNA. And then some is converted to methyl and it gets into that methionine cycle,
Uh,
recycling homocysteine and supporting methylation. So that it's basically an unknown variant, but it is an FDA contraindication, and that's the only one.
Interesting. Do you ever have anyone get like? Have you ever seen side effects at high doses of folinic acid at all? Like
Oh,
when they start.
yes.
Yep.
Oh, yes, because people don't know how to do it. They do it wrong.
Okay.
Absolutely. You can get a lot of activation, you
Yeah.
know? You can get a lot of activation, and here's why. This was a question that I really had to, because physiologically, some people do great with titration, some people do great starting at higher doses. And there are other times where people start it and they're like, wow, I didn't go to bed. Or, I had a mom that gave it to her 3-year-old at the time, and he took his little tricycle and he just whipped around the kitchen counter, all day, like for 4 hours. And she's like, wow, he had so much energy. I couldn't even believe it.
Yeah.
So the activation happens because once folinic acid gets in and it differentiates, it's increasing all of your neurotransmitters. So there can be activation of dopamine, serotonin, glutamate, you name it. So you have to do this slower titration for tolerance. So if
Uh,
I were going to prescribe 25 twice a day today to a 4-year-old, oh, they're going to get activated.
yeah.
After 6 weeks, they're going to get back to normal.
Uh,
Um, but nobody wants to wait 6 weeks for their child
yeah.
not to sleep and be really hyper excitable. So
Yeah.
you have to slowly titrate it in. You
So
have to
what's your
slow.
typical approach? Like, where do you start? I know it's probably specific per the patient, but where's like a good starting point? And like, do you have certain frequencies in which you increase it?
Yeah, I think the best starting point is to ask the question, why is there deficiency in the first place? Get to the root cause of why that is happening and work on that. Jana, one of the partners in my practice, she said, I saw the worst patient yesterday, Emily. It's the worst diet they've ever had. I can't even believe it. And the patient is literally will not drink water, only Coca-Cola,
Oh
uh,
man,
and eats 3 foods, and they're all like Oreos, Flamin' Hot Cheetos, and Fruity Pebbles, and that is that kid's diet.
there we go.
So
That's nutrient rich.
I mean, can you imagine the cerebral folate deficiency, that person? Where's
Yeah.
the folate in that? Maybe some folic acid from the Fruity Pebbles, but
Yeah.
like that's where you have to start. Like, is it nutritional because you're not getting it from your diet? Or where's the oxidative stress? Why is there so much inflammation that you're creating these antibodies? And
Uh,
how is the mitochondria supported so you can get the folate through the barrier because ATP is needed? So you
uh,
got to ask those questions. And often when I start, I'll just focus on inflammation for at least a month, and that might be resolvins like specialized pro-resolving mediators, high dose omega. I might use some glioplasmalogens. And, we work on removing what's the inflammatory stress and quelching the inflammation. And then we start really slow and titrate up. But another nuance is I like to make sure B12 is optimal before we start,
Uh,
because there's some thought about the B12 trapping in the brain. Have you ever heard of that before?
I have not, no.
So if you push folate too hard without adequate B12, there's a couple of studies to say that B12 that the folate will get caught in the methionine cycle and can't recycle because
Uh,
B12 is too low.
uh,
So B12 needs to be normal before starting folinic acid, and then you're going to have a better titration and you're going to have better tolerance. And then I might start at like 2.5 milligrams a week and do that, and then go up to 2.5 milligrams twice a day, and then go up to 5 milligrams and 2.5 milligrams, and just do that slow titration.
yeah.
And if you do a compounded nutrient, what you can do is say the nutrient size is, let's say, 6 capsules, you could start off with half a capsule a day,
Uh,
and then you get your dose because all the ingredients are blended. So if you have 20 milligrams of folinic acid in your formulation, start with half a capsule and then titrate up from there.
yeah. Yeah, can you speak to, I think there's a lot of people out there where they say, "Hey, everyone should be taking methylfolate. Methylfolate cures everything." And like how do you differentiate the use case for methylfolate versus folinic acid?
Well, I love methylfolate. I think it's one of the most beautiful forms of folate that our brain and nervous system loves the best. Um, but what's the problem with only methylfolate in some cases is if we have impairment in delivery into the nervous system, it's still going to be stuck, whereas folinic acid has the backdoor key and
Uh,
methylfolate does not.
uh,
So your brain is still, the methylation process is still going to happen into methylfolate once it's through, but it's a precursor that can help increase methylfolate, just like N-acetylcysteine can increase glutathione.
uh,
um, Sometimes nobody wants to do an injection or get an IV. They want to take NAC instead to create their own increase of glutathione. And we know NAC has tons of beautiful mucolytic antioxidant property on its own. So it's like folinic acid, methylfolate, NAC, glutathione, very similar dynamics to me.
yeah. With the methylfolate, do you run into more side effects with people taking the methylfolate versus the folinic acid?
No, I think you're going to see a little bit more activation than the folinic acid. And
Okay.
and what is really important to understand if it's happening, remember it's actually a good response. It
Uh,
just means you need to go back and go slower, and then you have to check the cofactors, right? What's the B12? What's
uh,
the oxidative stress? And methylation just doesn't need B12, it needs B6 and B2 as well.
yeah.
That's it. Those nutrients are feeding the methionine cycle, and those are often overlooked,
Uh,
but they're needed. Some people with resistant clearing homocysteine or methylation do okay on some betaine. Some do okay on adding inositol, but those are kind of rarer cases. To me, the foundational methylation cofactors are B12, B2, and B6.
uh. Yeah, it's interesting because I take folinic acid more so because, like, for me, methylfolate, I have histamine issues, and so sometimes it can increase some of the histamine response, and so I just really like the folinic acid and just its use case. I think we're just gonna continue to learn more and more and more about it. Like you're
Yes.
mentioning, even just how high can we titrate this, and just
Yeah.
the research behind it. But yeah, you kind of hesitant to jump to the high doses without a little more research backing it. I know, Emily, that you really do use genetics, and I know you talk on it, and how it really helps with neurodevelopmental and mental health. Like, what are some of the main things that you've seen, I guess, affect both of them, but like how is that the use of the looking at genetics and epigenetics like really help, you know, push your patients furthermore into recovery and to better optimization versus not using it in those two spaces?
Well, I think it comes down to protocols, really, because in the functional space, there's some big key concepts that will really help get a kid um, on better neurodevelopmental track, really honestly. Folinic acid is a big foundation, B12 is a big foundation, sometimes injections versus oral. But here's the nuance is everybody is different. We have 3 billion base pairs of genes in our body. One out of 100 has a variant in it, and it's what makes us special and unique and challenged. So when I work up a child with autism and I look at their genomics, I can see those nuances and those subtleties, and sometimes they're subtle and sometimes they're big, like if they have a shankopathy, or, it's subtle that in their autism panel, really not a lot of genes came up, but it's really the more foundational panels are really like they don't absorb B6 well, or they need a megadose of B6, or, all their oxidative stress genes are really high, and this kid is probably toxic,
Mm,
and has heavy metal toxicity. And seeing those genes helps me make better clinically informed decisions on where we need to go and what they specifically need themselves. And while there are similarities, certainly, having that kind of N of one data is so valuable. And you know what? If you had a child that was normally developing, say he was 2 years old, he was saying your name, you were going to the park together, he was sleeping well, and then all of a sudden he stopped trying to hold your hand, he stopped uttering your name, and he went into a world of his own and started banging his head on the wall and lost all verbal communication, you're going to want every advantage that you possibly can to get him back.
mm,
So, um, I think that that's important. If we have the privilege of looking and there's access to that, I certainly want to use it to our advantage, because I want to use every advantage to get that child back.
yeah.
Because there's a saying, and it's true, the earlier the intervention, the better the outcome. And
Mm,
I've been treating children with autism for 15 years, and I can guarantee you that rings true more than any other statement that I've ever heard.
mm. Do you find that there's I know you're speaking to the end of one nature of everyone, which is so true. Do you find that there's certain genetic pathways that are very prominent and more commonly seen, or levers that can be pulled? Say if someone for some reason does have access to an Emily Gutierrez or what have you, like are there easy levers outside of folinic acid that's just like, hey, this is you should focus on this, and then also common genetic pathways that are seen?
Well, I think something that is misunderstood, underdiagnosed, and really can be a huge lever for all of these families is the immune system.
Mm,
These kids have a lot more immune mediated neuroinflammation than they are given credit for.
mm,
It's been diagnosed as this neurobehavioral disorder, just like, it's your behavior and we're going to train your behavior to get you out of it. But
mm,
honestly, maybe that 2.5-year-old was full of strep, or, they had a lot of nutritional insufficiencies and infections at the same time. So their oxidative stress and inflammation was just in this ongoing inflammatory cycle.
mm,
So finding what is causing that child harm, it's often in their immune system.
mm,
If I had to put together the piece of puzzle that was harming a child that was developing, it's the immune system. And that can be from infectious sources, and it can be from non-infectious sources. Like, are they living in a room that has mycotoxins coating the walls? That's a non-infectious source, right? But it causes a lot of oxidative stress, and they can get a huge burden of mold in their bodies, which really activates their immune system and activates the inflammation in their brain. And once your brain has a lot of activated inflammation, it can become aberrant in development on how it's supposed to go. So,
mm.
long story short, and it's a long story and it's convoluted. I
Yeah.
mean, inflammation can be in the gut, it can be in the blood, it can be in the immune stressor, also can be in the environment. Heavy metals, mycotoxins, environmental pollutants. Do you know in California, 12 out of 1 out of 12 boys are diagnosed with autism. But in
Right.
the United States, it's 1 out of 32.
Huh.
And it's a 4-to-1 ratio on boys to girls, because the hypothesis is that estrogen is more neuroprotective and females have a higher level of estrogen. But
Mm,
it's known in more crowded, polluted cities, you have a higher incidence of autism. So,
interesting.
yeah.
Yeah, it's definitely a paradigm shift, right? And I think hopefully, it catches up sooner rather than later. But yeah, like if you were just to ask anyone, what's the cause of autism and neurodevelopmental disorders, they're probably not going to say the immune system or even consider the immune system if they're not have a connection to the functional medicine space. And yeah, it's such an
So
overlooked issue.
critical.
Yeah.
So critical.
Yeah. So I guess, I think there's a lot of stigma and opinions about kids and individuals with neurodevelopmental issues and mental health as well, for sure. And I guess, this is kind of you speaking to the parents or people that have it, like, because I think there's two camps. There's, hey, my kid is neurodevelopmental. I'm gonna love them for who they are. They don't need to change. This is how they were meant to be, right? So there's that camp, and then there's the other camp of like, I've got to fix this, right? And I think obviously, this whole conversation centers around you're always gonna love your kid for who they are. Like they have value in and of themselves, regardless of their behavior and everything else like that. So that aside, like, what would you speak to and say to a parent of someone? How do you best support their kid, loving them where they're at, but then also really striving to fight for a better life for their kid and allow them to show up as, who they were created to be.
Yeah, I think we need to blow up the word autism. That's what I
Mm, mm,
we aren't talking about the same person most of the time. So autism comes in levels 1, 2, and 3. Autism level 1 is the quirky kid that has problems with social nuance, that's highly intelligent, usually in one or more areas, that likes to be alone, that might not fit in and is considered neurodivergent. A level 3 child might be a 9-year-old boy that has never become potty trained, can't look his parents in the eye, can't be without his iPad for 1 minute, um, and has no ability to care for himself or be in the world, and is constantly chewing and stimming, chewing on a chewy and stimming 24/7. Now, don't you want to help that kid that's level 3? Isn't that a totally different level? That's totally different autism, right? So
mm,
severe autism needs a different name
mm,
because it's unfair to lump it all together. And you're right. I have family members that have autism level 1, and I don't want to change them. I love them. I love their quirkiness. I love exactly who they are. And have we had to fight for our relationship in different ways? You better bet we have. So knowing even which level of autism, maybe the education is different. Maybe the social emotional training is different. Maybe the approach to like, how can you be connected and have a relationship that is meaningful to somebody else that gets that social nuance and those idiosyncrasies in relationship. I mean, especially now that so many people's relationship is on a screen or in their phone. It's I don't want to change them. I want to help them where they're at, just like the level 3 kids. I want to help them where they're at too. And before we cast judgment on why are you trying to change me, let's just determine like what are we even talking about to begin with?
yeah. Do you find so obviously, we're talking about infections, immune system, nutrient deficiencies. We're talking about these one, two, three levels of autism. The level three, I'm sure you're getting a ton of that going on. With the level one, are you still seeing that? Is that still at play, or do you see that's everything looks good? That's just their personality and who they are. Like what? Yeah, what's the nuance to that?
No, we still see some of the same physiological dysfunctions. We still see folate issues. We still see an improvement, but maybe a level 1 child with autism that also has ADHD, which is a very, very, very common comorbidity. Maybe their Ritalin, Adderall never really worked because what they needed was high dose folinic acid, and that worked
Mm,
so much better. And I've heard that. I've seen that clinically a lot, a
mm,
lot. So it's still, you still try to understand the other stressors. You might not just have the level intensity, or the level of support that you give them.
mm.
Uh, so I hope that answers your question.
Yeah, no, I think that you have, some of the best experience and expertise to speak into that because I think there is a lot of like I saw this story of this guy. I think he's a broadcaster for a news network, and he growing up he had was diagnosed with autism, and his dad basically was like, I'm going to fight for this kid, right? And he didn't take no for an answer. I don't know if they even went into the functional medicine space. I have no idea what they did from that perspective. But now he's like the head anchor on a news show. And having watched it, I would have never guessed that. And so I think there's a nuance and a balance. 'Cause I think sometimes there's a pushback of, well, you should love me for me, right? Of
Mhm.
course. Yeah, like you're loved, but I think there's more that can be done. And this guy never would have had this experience and impact that he's having now if his dad wouldn't have fought for him, and he loved them the entire time, which I know you speak to. But yeah, it's just, I think learning about some of the things that could affect these people and maybe that allows them to show up a little better while still having quirkiness and all that, and just understanding the human condition. I appreciate you speaking to that because I think there is a lot of debate and there's a lot of heat around it, especially when it comes to identity, especially mental health, right? Where, there could be guilt or shaming for trying to improve someone. Oh, that's just me and I have chemical imbalance, so there's just a lot of that going on that to have you speak to it, I think is really helpful.
Yeah, and I mean, I celebrate quirkiness. I'm the biggest nerd of all. I love it. I marvel
Uh,
at the intelligent and the gifts some of my patients have. I
uh,
mean, it's beautiful to watch. Nobody wants to change their character or who God created them to be.
yeah.
They want to, we want to remove obstacles that could even make their life a little bit better. And that is different for everyone.
Yes.
Even if you have a diagnosis of autism or not, I don't care who you are. As a human being, we all have health obstacles.
Yeah.
So what does that look like for you? And for me, it's going to be different. And for all of my patients is different
Uh,
because we're not all the same. That's the problem with medicine. We're not all the same. We don't all go into the algorithm. We don't all have the prescription that's exactly the same. And, when you can really support, like, what did that news anchor's dad do for him? If they didn't engage in functional medicine, he did something that worked for him. And
yeah.
I celebrate that because he dug in, he supported him, he loved him. He got whatever resources he could, and look at how well he's doing. That's a
Yeah.
tremendous story. So
Yeah.
whatever an individual path for healing, none of us have it 100% right for every single thing.
Yeah.
And I think we can all learn from each other and celebrate everybody's wins and definitely celebrate someone's quirkiness and nuance and what makes them different and special because that's what makes the world interesting. Nobody wants to make everybody the same. How
Yeah.
boring.
Yeah. That's beautiful. Yeah, that's inspiring. That got me fired up. You just saying that. Yeah, I guess one quick question to that. Obviously there seems, there's some very high intelligence for those that are on the autism spectrum or neurodivergent. Do you find that as you treat these things, how does that interact? Do they keep the same intelligence? Is that like, does
One
that
thousand.
change?
Yes, 1000% they keep
Uh,
the same intelligence. And there's some science behind why some uh so why some people have higher IQs for some things, but Michael, intelligence isn't only IQ, and it doesn't mean it's in all pathways. We all have our own intelligence, and to some people they might have a musical IQ that is off the charts, or they have a memory that's off the charts, or they have a thought of logical reasoning that's off the charts, but nobody has an advanced IQ in every area.
uh,
So but when you improve upon your health, because that's what we're doing in functional medicine for neurodevelopment, we're just improving your health. We're taking you from dysfunction to a place of optimal functioning as best as we can. That doesn't take away your intelligence. The thought is when you're developing and you have some of this pruning that's happening during neurodevelopment, that pruning, we have all these neurons and we prune down to the most important ones, that the pruning is less in certain areas, so different areas of your brain could be overdeveloped or more
mm,
developed.
uh,
So what you'll see with some of these kids is they are doing ninth grade math and they're in a third grade classroom.
yeah.
And there's like, yes, they're so intelligent in math. And no, they're not intelligent on, how to make a friend
Yeah.
and, how to have a relationship. So
Yeah.
there's this big gap. And a lot of parents are dealing with that as kids are growing up. They need to grow, they still need that time for development for emotional maturity that comes with time, it comes with time. And you can't just be wise in third grade. You can be super smart, but you're not wise.
Yeah.
You're still a
100%.
third grader,
Yeah.
right?
Yeah. 100%. Yeah. Well, I could keep asking you questions on that, but maybe we can have you back on some other time. But yeah, I guess, where yeah, I want to give you some time to talk about. I know you've developed your supplement line. You put a lot of thought and effort into that based on your clinical experience. So I'll let you. I don't know if there's anything you want to highlight about it or kind of talk about why you built your brand and where to find it. But I wanted to give you some time to talk about that.
Well, thank you. I mean, I started formulating nutrients with personalized nutrients. And I love it because you really get to choose the ingredients you believe are best. And people get supplement fatigue. They do. They get supplement fatigue and they don't want to take their supplements, or you have a bottle and it's like, well, this has a 90-day, supply and this one is 30. And so you're constantly just like buying supplements, restocking supplements, and it's hard to be consistent. So, what I found over time is I was making very similar things all the time. And so when I developed neuronutrients, it was, well, if I want to lower glutamate, like you talked about having high glutamate before, I researched and, knew what was the best ingredients to have a synergistic blend to lower glutamate naturally without having to prescribe a benzodiazepine. So, when you can leverage things together in blends, which by the way, good luck if you're going to find a study on all of those blends happening together.
Yeah.
Um, my study was my clinical experience with my patients. I knew when I paired mag-threonate and L-theanine and pyridoxine 5-phosphate and inositol and when I paired those together, whether it be in our powder or capsule, um, and we put a tiny bit of passion flower in there as well, that's like your natural lowering glutamate.
Yeah.
You pair that. If you need more, you pair it with the NAC to go together, and you can have a really good lowering glutamate. And remember, glutamate's excitatory. It can cause irritability, agitation, stimming, seizures, sleeplessness. So when you pair those ingredients together, you can really have this effect that can be effective, in the moment and over time with that formulation. So I just put together those blends and, I did them also, not a lot of people are in the pediatric space in functional medicine. I certainly am. And I'm very research based. I graduated from Hopkins and I learned how to be a very good researcher. And I still value that tremendously, even though nutrients, there's not big farm dollars behind them. So, you're not gonna find the research as well, like vitamin C. Who who's gonna give you a $1 million to do a study on vitamin C when anybody can profit
Yeah.
from it? It's just
100%.
the way it is.
Yeah.
So, yeah, I formulated to make sure that it was safe in kids and we had effective doses in kids. And on our labeling, I have doses down for kids. I have kid ranges on the dosing. And if they're not there, it's because it's safe to take if you're 6 months old or you don't need an age range. But I think that's what makes us a little different.
Yeah, it was definitely a labor of love for you to create those supplements, and obviously you have such a strong clinical history to know, right? And so that's why you develop these products, and I'm sure I'm sure you have amazing testimonials, and you're hearing all these stories, which is what it's all about. So I guess where can they find these products, and then also if someone was like, hey, I love what Emily's doing, like how can they follow you, learn from you, etc. Like what's the best way to do that?
Well, my supplement company is Neuronutrients. And you can find us online. We also are in some pharmacies, and then we dispense on Doctor's Supplement Store for providers. We're in their formulary. And then Neuronutrition Associates is my functional medicine practice I started 12 years ago. And you can follow us on Instagram from there. And I have a course for autism for parents on there, that parents can go and get all the goodies on that. You can either do the course alone or do the course and follow up with my health coach. So you can find me online there.
Yeah. Awesome. Well, yeah, I highly recommend doing so. If you obviously everyone learned something today, but yeah, she's such a great resource. So Emily, we're very grateful for the relationship we have with you, for you coming on today and taking your time and sharing and educating us all. So yeah, thanks so much for joining today.
You're welcome. It's been a great partnership with you guys. I really believe in personalized nutrients. You don't pay me to say this. It's just I have a very I have a lot of loyalty towards you guys, and I know you're doing good work, and I trust the ingredients you're putting together. and I always trust the bottle when I get it, and that's what I depend on for my own supplements. So I appreciate the work that you're doing. It's very niche, and you're definitely the leaders.
Awesome, man. Well, thanks so much, and yeah, thanks everyone for listening, and yeah, we'll be back soon.
All right,
All right.
thanks.
Thanks, Emily.